Your skin has trillions of bacteria on it all the time. So just waiting for an opportunity to go inside you. She was in a very bad motor vehicle accident and fractured her neck. So she's paralyzed from the neck down. There have been multiple hospitals and nobody could help her. And we had a very serious talk. Initially, when I first saw her, I didn't think she would make it and that this wound will probably kill her because of infection.
And that's something that typically happens when you're bedridden.
I mean, one time there was a guy and I see this golf cart pull up in the parking lot. The guy comes running. He's got a towel on his chin and it's a big gash on his chin. I get him into a room, clean him up itself, and then we suture his wound. And then I said, okay, now what? You need to go home, take it easy. He says, no, I got a golf game to finish. My diabetic patients, my advice is do check your skin in the feet area between the toes. If there's a problem, sore you feel or something, don't just ignore it. No, it will not go away.
The season of health is on cruise through HTX. And a brief reminder before we get started to please, for the love of all things sacred, talk to your primary care physician before trying anything you hear during any of these episodes this season.
Dr. Moosa, I'm a serious person, I promise, but I do have to know, when was the last time, seeing as how you're a wound care doctor, the last time you were grossed out?
About 6 months ago.
Really? That long? Is it that long or that often?
No, it's that long. I don't get grossed out as much ever since I started wound care. But that one, I had to do a double take and I had to take a few steps back because it was a very large wound and a pretty foul smell to it. And the family around it was so used to it, I guess it didn't budge them. But I had to take a step back and rethink, oh my God, what am I going to do? What am I getting into? It almost felt like it. But you see every now and then something, you just scratch your head like, I don't know what I'm going to do, but let me think methodically and come up with a game plan. And that's what I love about wound care because there's no two wounds are the same, really. So you have to think outside the box a lot.
When was the last time you had to think outside the box for something that would be a typically normal kind of a thing?
So just this yesterday, actually, the patients I had were all what I would call routine. The diabetic with a foot wound or obese person with what are called vein wounds, in the legs areas. So all of them were basically one after the other were in that category. The one that had taken my breath away a few months back, she did come in and it's so much better now. I'm very impressed with what we are able to accomplish with her. But it's the daughter, and I have to give kudos to her because just give you a brief aspect that she was in a very bad motor vehicle accident and fractured her neck. So she's paralyzed from the neck down. And the daughters are the ones who are taking care of her. And the daughter literally just picks her mom up from the wheelchair to take her to the bed. And so the daughter's been a good proponent of her. And because of that, this lady has survived all these years. I think the accident was about 30 years ago. Yeah, that long ago. This lady has survived, really. It's amazing. But the wounds, before there have been multiple hospitals and nobody could help them and this and that. And we had a very serious talk. Initially, when I first saw her, I didn't think she would make it and that this wound will probably kill her because of infection.
And that's something that typically happens when you're bedridden, you can't move. Right. The wound, I guess the wound doesn't get enough air or what?
Well, it's a pressure. It's a pressure on the body, but also her diet was not the best. And the pressure area and the rectal area being close, and she was having episodes of bowel, problems, and so that would contaminate the wound all the time. She ended up in the hospital. So we finally talked, and all the doctors had said it, I think, in the past, but she didn't want to do it. But what they call a colostomy, a temporary colostomy, where they put the bowel in the belly area, put a bag. So she had to get that so then the wound would not get contaminated. And sure enough, it turned the corner around dramatically.
Dr. Moosa, you've been doing this for more than 5 minutes. When did you realize that this was the area of medicine that you wanted to get into, and why?
So back in 2006, the hospital in Pasadena approached me because they were opening up a wound care center. And they wanted a group of physicians. And they wanted also a family doctor who would be willing to do wound care, because in family medicine, you're dealing with diabetes, we're dealing with nutrition, smoking, all those things which affect, wounds. So they needed somebody like that. And I always loved doing suturing and, taking debridement or getting warts or this and that. So minor surgery in the office, I always loved that.
I always loved that, following wanting to do warts and sutures. I can't with you.
You'd be amazed what I've seen.
I would be amazed.
I mean, one time there was a guy, I was leaving the office in LaPorte, closing up the door, and I see this golf cart pull up in the parking lot. I'm like, what the heck is going on? The guy comes running. He's got a towel on his chin.
Oh, no.
And he says, are you Dr. Moosa? I'm like, yeah. He goes, hang on. He pulls, and he said, a big gash on his chin. I'm like, whoa. And I was about to say, go to the emergency room. But I said, you know what the heck here? I said, come on, let's go inside. And all the staff is gone, so I get him into a room, clean him up itself, and then we suture his wound. And then I said, okay, now you know what? You need to go home, take it easy. He says, no, I got a golf game to finish. I'm in the middle of the 18 hole and I paid for this, so I'm going to go. I'm like, okay. Well, told him what to do. I said, well, you need to be back in 1 week for me to remove the sutures. You go, well, I'll be in Wisconsin, because he's one of those traveling, guys. He said, I'll be in Wisconsin, then I got to go here and there and there. But I feel like comfortable enough. I'll remove it myself. Don't worry. I'm like, okay, hallelujah to you. Never saw him again. He got his golf cart, went back to the golf course. I saw him. I'm like, oh my God, this guy's amazing.
Oh, wow.
So the things I see, yeah.
Would you recommend that for anybody else who was not that guy? So if it was just me and I didn't have golf, or if it was a minivan driving mom, would you have handled that? How would you have handled that differently?
I would have said, just go home, take it easy, because, you can bleed and things like that, especially in LaPorte heat. I mean, the Texas heat in the golf course, because you got sweat going on and you're swinging, you never know. And the reason for him, he was too close to his buddy, and the buddy was swinging, and the golf club swung around and hit him right on the chin. Smack. And his buddy was the one who brought him in, and the buddy said, I'll pay for it. Don't worry. It's my mistake. I should have told you, stay back,
It's a very Texas thing, though.
It is. And I mean, to me, I said, you know what, listen, it's a Friday. I have no idea how to do the front desk itself, So I'm not going to collect anything right now. But just whenever you get back into town, come back and tell the ladies, and then we'll settle it. I don't know whether he ever came back. I have no clue about it then. Because it was on a Friday or something like that. And it was a weekend. I forgot about things.
Wow. Wow. Okay. That is fantastic.
So that's why I said, you see that, and then you see this daughter who's a proponent for her mom. You see the variety. And then the kids that I see, because they did something. Even my son, one time I remember we were temporarily staying in an apartment, and my wife Ashma calls saying, where are you at? I'm like, I'm headed home. She goes, can you bring a suture kit? I said, uh-oh, what happened? She goes, well, Issa, my son, he was running around and he hit the corner of his eye on the edge of a table and cut himself. So I brought the stuff, and we're like, what are we going to do? We are by ourselves. So she held him and, numbed it up a little bit. He cried, but then I sutured him up, and we were both, because she's a nurse, me being a doctor, so we were in our game. And after we're done, we both sat down and looked at each other like, what did we just do?
Okay, so how old was Issa?
He was, I'm trying to remember, 5 or 6 or something like that.
Well, good luck getting that to someone of that age, right?
Definitely.
Yeah.
But, he had grown up, because ever since he was very young, we brought him to the office, because my wife was office manager, in the triage nurse, and so everything she did in the office. And so we didn't have a nanny or other family members to help. So as soon as she said, I'm going to come back to the office, she brought him in. We put him we had a room set up for him. And then we had one of those bouncers that you put them on the door or in the between the things, and they sit and they just bounce up and down, up and down. So we had him in one of the doorways, and even the patients who loved him, they even changed his diaper, I think, one time.
Oh, wow. Okay.
And then he would get into this and that, and he would always watch me doing things.
Yeah.
So he wasn't too afraid of medicine or, what I did. Even my daughter, one time, same thing. The laceration came, and the patient, I was suturing up, and my daughter's peering around the corner, and the patient says, she can come on in. That's not, as long as you're happy, doctor. I don't care if she watches. And I said, okay, fine. And so she came in, and she was very curious about it, watching me doing my work. So both of them grew up in the office. So I told him what I'm going to do. So he knew what I'm going to do. So, he had an idea. But I said, it's going to hurt a little bit first.
Yeah.
But the numbing was the toughest part. And so mom held him straight and got it done. But like I said, we just sat back at the end like, what the heck did we just do?
Yeah, really?
Yep. But he still has a scar and reminds us of that.
Never forget.
Never forget.
Never forget.
Yep. That's when I said, this is when you don't run around corners and hit things.
He doesn't run inside anymore, by the way.
No, don't. Otherwise you get into trouble.
Yeah. Okay, so I've got to ask selfishly, because it involves a previous trip to the ER. How do you convince newbies into your practice that you're going to see some stuff that may or may not disturb you? So do the poker face in front of the patient.
I mean, I because I do teach with UTMB Galveston, the students who come there, but these are third year, so they've already been exposed to some of the things. But if I see a student, like a high school student who's shadowing me, or a student nurse on the floor, I'll tell them, hey, you want to see something? Come on. But I said, first, I need to ask you, do you get very queasy with blood and pus and smell? I just feel it out first. And then I'll watch them. When I'm doing things, one eye is on the patient, the other eye is on them itself. I'm watching. And there's a few times I had to say, why don't you go and sit in the corner over there, because I can see them turning a little color.
Oh, goodness.
You can tell. You can tell they're turning colors.
Do they turn white, green, blue, brown?
Whitish color, and you can see sweat beads. When nobody's sweating and they're sweating, I'm like, go sit over there.
Sweat above the mouth, on the side, the forehead. Okay.
Oh, wow. Right away. And you can see them, they're getting a little queasy or moving around a little bit, this and that. So you got to watch them the first time. But if they're seasoned nurse or whatever, no big deal. They'll come in and they'll roll up their sleeve like, hey, doc, you want help? Come on, let me help you there.
Yeah.
But usually when the new nurses are there, I'll actually have them feel the wound itself, so they know what it feels like touching a bone or something like that in the wound.
Touching a bone.
Yeah,
oh my gosh.
Even the students, medical students, I was at the hospital, and this patient had a big wound in the back, and the bone was palpable. I mean, you can touch it. So both of them are family medicine. This was the first rotation. So I'm like, come here. And they're both like looking, and you could tell they're like, oh my God, that's a huge wound. I said, okay, put your glove on. And they're like, okay. And they're looking at me in a way like, what are you going to do with us? I said, feel the bone. That's when one of them was very timid, I could tell. I'm like, you're going to be a family physician or doc? Come on. You're going to have to see some of this stuff, and you know what it feels like. So both of them did feel it eventually, but you could tell they're very timid on putting the finger in the wound areas, First time you always get that as a medical student. When I first even wound care, I started out, I didn't know. I was like very timid. I was like, I can suture in there, but trying to go much deeper into the muscle area, I was like, ooh, I haven't done that. But, you get with practice and your anatomy and things like that, and things come back, really.
I wonder how often people drop out of medical school simply because of that. They made the grades in high school. Yeah. They got the merit scholarship, and they are just ready because they saw Grey's Anatomy and they want to be, they want to be Dr. McDreamy. Yeah, exactly. And they get in there, it's their first whatever experience, and
exactly.
Right?
No, that happens. We had
more often than not, or
more often than not.
Really?
People don't realize, it's very tough to get into medical school, and you think, oh my God, we've been through so much to get into the school. But we have had, in my medical school, I remember, where the first 2 years is more lectures. You're in the classroom. So you're looking at slides and this and that. You're not doing much patient care at that point, really, patient contact. And so when the third year comes around, even our school tells us about, at that time, at least 1/3 of the class will say, can we delay it? I don't want to go to this rotation. I'll sit it out for 2 months. I got to do a few things, and then I'll go to the rotations type things. And sometimes they say, you'll see that a lot. And so they'll say, when they first meet the patient, they're very scared about meeting the patient. That one-to-one of having somebody, it's something that's different. Classroom is different, but when you see a patient and talking with them, when I get the students first time, they're like, what do I ask? They have no idea. Okay, I said, simple thing. The patient has a sore throat. I said, what would you tell me if you had a sore throat? Put yourself that way. What bothers you?
You're building empathy.
Yeah. So I tell, okay, what would you say? Oh, I have a sore throat. What else? Oh, yeah, I'm coughing. I'm like, that's what you ask. Same thing. As if you have it, just think about the things, the symptoms you have. Ask them those symptoms, are there or not there? Then use your medical knowledge that you have been accumulating for the past 2 years. Okay, that's a throat area. Tonsils are there, this and that. So now let me feel, because you've been through anatomy class, so you can feel the glands and things like that. That's when they get a little bit more comfortable. Once you first touch a patient and actually talk one-to-one, then you see them get more comfort. So by the end of the 30 days that they're with me, I see that the level of improvement is there. And they have the more of that, like, okay, now I know to talk. And they're scared that the patient may be upset or whatever. But the patients I've been with, they know I bring students in there, so they're always welcoming. Oh, you got a student there? Come on, bring them in. Come on. And they'll joke, or they'll say something just to throw them off, off guard. But they do that to break the ice.
It seems like it would also lighten the mood for the patient as well.
Yeah, patients love because now they've got welcoming, and they're not like in that type of, because in some hospitals and some departments, the stress level is extremely high.
Oh, yeah.
And the students can palpate the stress level, really. And so they get very nervous. When they come to me, I'm like, I'm a family doctor, listen. And I treat families. And so, and here with Texas, we are very casual, okay? When you come to the family doctors, we talk about, hey, what's your last trip? And what about your dog? And this family or that. You become a family doctor with them. And once you get that connection, that's it. When I first came to town, I was wearing a coat, I remember, and jacket. And one of the people there, it says, you're doc, you're in Texas, you need to let go of the jacket there. And this coat, that doesn't fit up. We're Texans. We like more casual. That's when I learned. I'm like, oh, great. I'll get rid of the tie and the coat.
Yeah.
Just come in. So that made me more comfortable. And I think the patients felt comfortable. But also the kids, when they see a white jacket, they get a little bit, oh my God, he's bringing a shot. That's all the thing is, a shot. And even parents will tell, I'm going to take the doctor to get you a shot. Oh my God, don't do that. Don't tell them that.
No.
So that's when when I go to the kids, I always tease them. If I'm looking in the ear, I say, I'm checking for Elmo, see if Elmo's inside there. And they go, oh, really? And they get, nervous, but they get excited. Like, oh my God, maybe I'll find Elmo in there.
Yeah.
So I always tease them. Even the parents, some of the parents have recorded me. He said, wow, you have great knack with the kids itself, So I said, yeah, you got to make them feel comfortable. So when they come in next time, they're not scared. So you got to break that down.
So Elmo's a trick. What's your other trick?
Well, sometimes I'll take a coin and put a bit in my fingers and go behind the ear and say, ooh, look, you had a coin. Maybe you have something else. And they go, oh, yeah, please check. Make sure there's nothing else there. So I'll do that. And then like when they're saying the I'm like, I have a lollipop stick, but you can't have it until you show me your tonsils, and then you can have this stick. First, I get the parents' approval, like I'm going to give this, tongue depressor to them to play with later on. So then they get more comfortable.
Yeah.
And then sometimes I'll take the stethoscope and put them in their ears, and then let them listen to the heart.
Yeah.
And you can see the eyes like open, like, oh my God, what is that noise? Here. But then they break down. And that's what I like about, just that the kids' eyes just light up there.
Yeah, the curiosity.
Oh, yeah.
Yeah.
But once you break that down, it makes them feel more comfortable, really.
Absolutely. Yeah. So let's shift the conversation to something that you take care of as a wound care doctor, and that is diabetic patients. And the ideal is that you don't have to see these people because they don't have diabetes. And so what would be your tip for someone who maybe is not, I guess, it's not terminal, I guess would be, I don't know if that's the right word, like there's still time
Yeah.
They've still got a few more birthdays to collect before they have to get an amputation, before they have to lose a toe, before they have to lose a foot, because we all know once you start losing parts.
You do.
Yeah.
Exactly. That's very common. So that's why in my diabetic patients, I'll tell them, listen, every evening when you're taking your socks off, please feel the bottom of the foot. You don't look at your bottom of the foot, okay? So feel the bottom of the foot and check between your toe areas before you get into bed area. This way, at least you have looked at the feet and always feel the sensations. When you're cutting your nails and things like that, make sure you're doing good. If you accidentally cut your skin, don't just ignore it, because sneakers and shoes, you got to realize there's sweat in there, and then the darkness is prime for bacteria and fungus to grow. So my advice is, okay, do check your skin in the feet area between the toes. If there's a problem, sore you feel or something, don't just ignore it. It will not go away. You got to address it and come in earlier. The sooner you come in, the better it is. Also, skincare in the feet area. So yes, you're cutting your nails, but make sure if you got callus or something like that, you are taking care of it. Go to a spa itself and let them take care of your feet. If there's a callus, they can shave it down themselves. And they know pretty well what to do, as long as it's a good place to do it. And then your footwear, you have to make sure your footwear is a proper one, that you're not too tight or something like that. That's very loose. That's sort of rubbing against your skin. Your socks, you have to make sure they're comfortable socks. And the nylon or something artificial that traps moisture in there can create a bigger problem. And then once you see a wound itself or something, like I said, coming in, have your primary doctor see you first so they can take a look at it. If it's something simple, they'll take care of it. But if it's not getting better, then they'll come to us and we'll take care of it. The biggest thing some people don't realize is your blood sugars. That has a huge impact on wound healing. If you are diabetic and your blood sugars are above 180, okay, the wounds don't heal well.
What's normal? I feel like I should know
normal,
this.
like a non-diabetic would be less than 100.
Okay.
Fasting sugar should be less than 100.
Okay.
If you're pre-diabetic, it's between 100 to 125 is pre-diabetic.
Okay.
And then 126 and above consistently, that's a diabetic. But if you're very careful with your diet and exercise and losing the weight, from a diabetic, you can become a pre-diabetic. You can go backwards.
Oh, yeah.
So that has happened. But the idea is that to push the patients to say, hey, doesn't mean that, you're diabetic, you'll keep going forward and end up on insulin and this and this and this. No. Lifestyle change is the first thing we always recommend.
Oh, yeah.
But the diabetic foot wounds, if you take them early, because once you got amputation, the sad statistics is that quite a few people will die within 5 years after an amputation.
It's unfortunate. I lost my grandma like that.
There you go.
Yeah. Yeah.
So that's why we don't want to see the amputations. Because once you do that, yes, it's very bad. But that's why and the longer you're diabetic, you have to have your circulation checked. And so talk to your doctor saying, hey, I've been a diabetic for over 5 years. Can we check the circulation in my legs just to make sure everything's okay? And that's the best way to prevent, because if your circulation is good, that's a good chance. So following all those steps really helps out.
Okay, so building on foot wounds. So I have been petrified of foot wounds ever since I found out that President Calvin Coolidge's son died from an infected foot wound.
Yeah.
Because that was back in the 1920s. We've come a long way since then.
Exactly.
But still, it's enough to kind of, it's enough to scare you straight.
Sure. Definitely.
Let's say I step on glass, which has happened in my house. You break something in the kitchen.
Right.
You miss a spot with the vacuum.
Right.
And ow.
Yep.
But you have to go, and you've got a long day of work ahead of you.
Yeah.
And your feet are collecting all that moisture, just like you said, moisture,
Right.
bacteria. And of course, I'm thinking about poor Calvin's son died so young.
Yep.
And so what is this is a very tactical, weird question. I understand that.
Right.
But what is the proper amount of time to air out?
So usually we tell patients that if you get a cut or whatever, you clean the area first, okay? Initially, if you're using alcohol or peroxide, that's not a problem, but we don't recommend alcohol or peroxide on a long-term basis. So the wounds, let's say the wound has been open for, let's say, about a week to 2 weeks, and you keep doing alcohol cleaning, you're actually preventing the new cells that are trying to come in there, because alcohol is toxic to the new cells that's growing in there. So first, do clean the wound, okay? Number 2, evaluate the wound to see how it is. How does it look to you? Don't just feel, oh, I'm just going to feel it and not look at it. No, look at it, because if it's deep, then yes, go to your doctor itself so they can take a look at it. If it's very deep, you might need some suturing or the bonding, with the glue itself to seal it up. But if it's just a scratch type thing itself, and you know that there's no other debris, nothing penetrated your skin deep inside, you clean it up. Do put some antibiotic ointment in it, because your skin has trillions of bacteria on it all the time.
Oh, yeah.
So just waiting for an opportunity to go inside you. So if you scrape it, you have broken the barrier. They're all going to get in there. So once you clean it up and you put an antibiotic, do keep it covered, because what we found is actually when your wound is open and it's dry, the new cells cannot come in there, because it's like a desert. Nothing grows in there. Oh. Your skin always needs moisture, so the dry skin cracks open, remember? Okay. So we don't want it to crack open. So if you keep some sort of antibiotic ointment and then put a bandage on it to keep it covered, that allows the skin and tissue to come in there faster and heal it up faster.
So you hear that, everybody? You cannot take off your shoes at work if you end up stepping on glass. You get a wound. You got to keep your shoes on. Nobody wants to see your feet.
Don't smell it, no. But at least if you take a look at it, and then 2 or 3 times a day. So in the morning you're taking a look at it, in the evening you're taking a look at it, just to make sure that, hey, it's looking right. If it's a scrape and you have done pretty good in healing in the past, you should do pretty well with it. But the idea is to keep an eye on it. And one of the tricks I've told my patients itself to take photographs. So with their phones nowadays, you take a photograph so you know what it looks like. Because what if in a week, it gets worse or something? Then you can go, if you go to the doctor, like, hey, this is how it started out first. This is where we are now.
Yeah.
And I get so many patients coming in and they got wounds like crazy. And they always tell me, okay, can I show you what it was? I'm like, yeah, I want to see it first, what it was, so I know where we are.
We know now. Dr. Moosa wants to see it.
Actually, we laugh because my wife, I always get this, I'm getting a dirty picture. It's of a wound from either one of the nurse practitioner or the home health is sending me pictures. And here in the middle of dinner, I'm like, oh, that's a good one. Honey, you want to see it? Like, oh, come on, get out of here.
I bet you're fun at parties, too.
Some people love that. Oh, that's a good one. Can I see one? Like, no, that's okay. So we try to, keep a log of the wounds here.
Yeah.
So we know how it is, because a picture is worth 1,000 words. So it actually speaks volumes. I always tell my patients, please take photos of your wounds.
Yeah.
So I know.
Send them to me too on Friday nights when I'm at dinner parties.
Exactly.
Trying to enjoy our lobster bisque. Ooh,
yeah.
This wound actually does look like lobster bisque. Oh gosh.
Remember that movie Fletch, where Chevy Chase was he's acting like a coroner, and the guy, come here, look at the gallbladder. Have you seen it? Not since I had lunch before. Something like that.
I remember the movie, but I don't remember ever seeing it. But okay.
So there's a line in there. As a medical doctor, I laugh at the line. Believe me.
Goodness. Okay, so another selfish question. Back when I was a irresponsible 12-year-old running, I was latchkey generation. Okay, right. Gen X. This is just what we did. I was running in a field with some of my buddies because it was summer and our parents were at work. And so what else would you do besides play video games?
Right.
You get bored of playing Metroid and beating the boss, right? So you go out, you go in the field, and it's tall grass. Oh, we found a shed. So we're running to the shed. Well, what does Freddie do? He steps on a board. Unbeknownst to me, there was a big old rusted nail pierced right through my thumb. He just right there. But it was like, I don't know if I guess you call that a puncture wound.
Yeah, puncture
it just came right out.
Yeah.
And so now I want to know, because that nail was obviously not fresh and clean from Home Depot.
True, yes.
How lucky, on a scale of 1 to 10, how lucky was I that I'm still here talking to you
and didn't lose a foot or something like that.
Didn't lose a foot or worse.
No, that's very lucky.
Because I didn't tell my mom.
Oh, wow.
Yeah. So it's like really.
How old were you then? Do you remember?
12, about 12.
Oh.
Yeah.
So the good thing is you're up to date with your tetanus at that point.
Okay.
Because, with school and the tetanus vaccines. Mm-hmm. So at least you're, from a tetanus viewpoint, you're protected. But the other bacteria with the rustiness and being on the ground, you don't know what's walked, what's peed, what's pooped in that area.
Raccoons, all kinds of critters. Yeah.
So you're very lucky, because that has happened to a patient of mine. She had a very bad diabetes. She didn't feel her feet. So the nerve damage.
She didn't even know.
She didn't. So she walked out in the yard. She had flip-flops on, and there was a nail. She stepped on the nail, did not feel it at all. Okay. Now the nail is stuck with the flip-flop and the foot. She comes inside the house. She gets on her recliner with the flip-flop still in place in the evening, puts her recliner back and falls asleep. Till the morning, that thing is still in her foot. So the morning comes, she gets up, she goes to the bathroom. When she comes out, she sees blood on the ground. She says, "Oh, what is this?" That's when she realized, "Oh my God, I've got this nail in my foot." No. So it comes to the emergency room. It's so lucky that it went between the bones, so it did not hit any of the bones area, none of the major structures itself. So the ER people pulled the nail out itself, the podiatrist and them, they did all the scans, everything else. They gave her a shot of antibiotic and all that bit, and they cleaned out the wound. Then they go, "Okay, you need to go to Dr. Moosa because you might still lose your foot. We don't know, So she came to me, and we doctored it up, and we treated it. And actually, we saved her foot. So those nails can be a huge, huge issue. So whenever it occurs, like I said, one is you got to clean it up properly, and really killing all the bacteria and things like that, and then putting antibiotics in there to kill whatever residual bacteria is there. What we worry about sometimes is if it's a rusty nail, some of the rust particles can be left in there.
Right.
Okay.
Yep.
And they can create what's called granulomas, these pockets where the body sort of surrounds it. But you can have persisting pus coming out of the area for a while because the body's trying to push and the body's trying to do its job. So we let the body do its job. If it's pushing it out, pus or whatever, let it come out. If it's open and pus is coming out, we don't want it to be sealed up on the outside and it collects in the underneath part of it. That creates a bigger problem. So when a wound is open, especially if it's open for a while, people will come in and say, "Hey, it's been open for like 2 days. Can you just suture it up for me?" No, I'm not going to do that because it's deep, and so I need to let it heal from the inside out. So once I explain to them what I'm doing, then they say, "Okay, let's try to do that one." So we have so we put antibiotic ointments and a different type of material in there to help with the healing process, cleaning the wound properly. And then if they have underlying issues, if they're diabetic or if they're a smoker or alcohol usage or some other things, we try to educate them what to do for that.
Incredible how all those deciding factors, like all the lifestyle choices, can really impact you.
Yeah, it's amazing. You don't realize. So your whole body, if you talk about feet, your whole body's on those 2 feet.
Yeah.
So the weight you have up here, if you look at the laws of physics, there's a lot of weight on the knees, actually almost double the weight and triple the weight on the ankle areas.
Yeah.
So those things have to carry all of the weight. So anytime you're pushing on it, that tissue is being squished a lot. Now you have a puncture wound in there, you're just making matters worse. For you. So we have to tell them to get special shoes to get the pressure of that area. Sometimes they have to use a cane or a wheelchair or something like that to get the pressure of that so it can heal up properly. Wow. And if you don't eat well, protein-wise, the wounds don't heal properly. You smoke. You're smoking. When you're smoking, carbon monoxide is getting in your system. Carbon monoxide comes to the wound. The wound is like, what the heck? Body says, I need oxygen. So you're not helping that. Like say if you're diabetic, if you have vascular, so if you have circulation problems and things like that, that makes a problem. Now, if you have other issues going on, other medical problems, or you are being treated for, let's say, for cancer on chemotherapy or whatever, those also slow the healing down. So that's why they wanted a family doctor in the wound care centers, because we don't just look at the wound, we look at the person and address the medications that they're taking, what they're eating and drinking and things like that, and then addressing the wound. So it's a whole picture you have to do. You can't just look at the skin and say, I'll just put a bunch of antibiotics and that'll be it. You can't do that now.
Okay, now I want to ask you, because you brought it up, protein.
Yes.
There have been more than just a couple of doctors that I've listened to on various podcasts, different kinds of doctors talking about, I guess, I don't know if this is the new science or maybe this is just kind of, it's with the advent of podcasting that now you're just hearing more of it, but that you should be eating your body weight in grams in protein.
So anytime you have a wound, first of all, so your body has a certain requirement it needs to function. Your brain, your heart, and everything else, there's a certain amount of calorie that the body says, I need for this area here. So let's say if you're eating only 2 meals a day, the body says, hey, with those 2 meals, these body parts are functioning. Okay, I'm okay. But now you throw a curve. You have a wound. the body says, oh, wait a minute, I need protein for that area,
Yep.
but you're not eating it. So I still need the heart and others to work. So I'm going to put whatever trinkets of protein as remaining extra, I'm going to put it over there. So your hair, nail, and skin take a beating anytime you are not eating well. So you have to realize that when we see a wound, I'll tell them, okay, listen, if you're getting how much protein, and they go, I'll eat maybe 2 meals a day. I'm like, okay, what's in the 2 meals? Maybe a little bit here and a little bit there. If you calculate it out, maybe 60 grams of protein they're getting over. I'm like, we need about 120 grams of protein for the wound to heal. And that's when they're light. I'm like, how much? I said, that's about 3 to 4 chicken breast equivalent. They're like, oh my God, I eat 1 chicken breast only. I'm like, okay, let's talk about protein powders or other. So oatmeal is there, beans are there, lentils are there. So try to give them a little bit more, things. That's when they open up. Like I said, you're not helping yourself. And usually the wounds that I see is because they are not eating properly. Really, quite a few times it's just that.
Okay, so you say 120 grams.
As long as the kidneys are not an issue, because we always, if they're getting kidney damage or some other issues underlying, that's why I have to look at the whole picture. And sometimes let's say the kidney specialist tells them, hey, you can have this much protein because your kidneys are damaged. I'll say, okay, go with that one here, and we'll work with our end.
Wow.
But you need a lot of protein really for the wound healing.
Okay. Yep. Learn something new every day. All right. Well, Dr. Moosa, this has been so much fun talking to you. I have, I've known Dr. Moosa and his wife Ashma for, I would say a little more than 2 years now. Exactly, always a pleasure to see the two of you. You can see Dr. Moosa at CLS Health over here on Kobayashi Road in the Clear Lake area. Website to go to learn more about what you're doing?
So cls.health.
Okay.
Yep.
All right.
Get there, all the information there.
Fantastic. Thank you so much for letting me crash your office and talk with you.
Anytime.
About all the disgusting stuff.
The dirty pictures.
All right.
Thank you.